Record.
I'm mastering my millionaire mind. Cut the cord from the past that bind. Yeah, I'm mastering my millionaire mind. I'm mastering my millionaire mind. Of the heart that made me strong, the pain that won't fall slow. And you're mastering my millionaire mind. Yeah, I'm mastering my millionaire mind.
All right, everybody, God bless you. We are so happy to be here together. Man, this is exciting. Hey, there he is, the man of the hour. All right, we're recording. We're good. Everybody give me a thumbs up in the chat. Can you see or hear? Yes, we good? Wow, we just came off an amazing call for My Millionaire Mastery, our first Super Saturday. Omar, let me turn it over to you. Just give us a brief 1 minute synopsis. Keep it short. What happened?
Wow, what an amazing 2 hours. Ooh, you need to be a VIP. That's what I'm saying. Like real life experience, mentors, coaches, you're gonna have everything there. So thank you, Steve. Amazing 2 hours. I'm fired up. Ooh, sweating. I
It
got my
was it was
AC.
amazing.
I got
Now
my AC
we are
50
having a
degrees.
big storm
Sweating.
right now. I'm hearing some heavy torments. So just in case, Omar, if I get knocked off, you can take over. But let's jump right into it. I want to introduce everybody to something I've literally been looking for years. We have had hundreds, literally hundreds of reps, members in our company come to us and say, man, health insurance is too expensive. What do you guys, you're here to help us save money. What are you going to do? What can you help us with? And I've never had anything that I felt completely at peace with and also at pain with, because the pain makes me want to go get something better. And I have a very good friend who actually brought us the car insurance deal that we have, right? Who introduced me to a good friend of his, who he's known for years, who introduced me to a good friend of his who is on this call. And this comes from the highest level, highest caliber, highest respect, highest feeling of, you know, reality, the reality of what's going on. Before we get started here, I'd just like to find out quickly if you're on this call, if you could put in the chat, if you are a health insurance agent, I would like you to put a me in the chat. Just put a me in the chat if you are an agent. And I'm not, you don't need to be an agent for this, but okay, so George is, and okay. Anybody else is an agent that's on the call? All right. So if you want to be an agent, that's a lot of work, a lot of money, a lot of stuff, and we need insurance agents for sure because insurance is great for some people, healthshare is great for some people. Now, if you're somebody who knows somebody who's an agent, Emma's an agent. If you know somebody who you know an agent, right? You know somebody who's an agent. I want you to put a yes in the chat. And let me see if you know anybody. Okay, Bill does, Omar does, James does. Okay, good. And Emma does, Cesar does, okay, Francis does, most of us do. So, Anna does. If you are interested in either saving money in healthcare for yourself or referring others so they can save money and you can make residual income, put a big fire emoji or a rocket or some kind of cool emoji in the chat. Let me see. If you're interested in either saving money with the healthcare or referring others and making money. Yeah, a lot of people in here. Okay. So with that being said, I kind of have a feeling for who you are and what you're doing, what your intentions are. And I want to introduce this gentleman. He is probably known as one of, if not the foremost experts in health, in the health share industry. Lives in Texas and has come very highly recommended, right? I guess he's a Longhorn. But anyway, I'm going to shut up. But the way this call is going to go, Ron's going to explain to you a little bit about what this program is, and then how it could benefit you or other people in your life. And then after that, we'll show you how we could get started, how you could get started today, that you could actually start being an agent or a representative of this amazing HealthShare ministry. And then we can take some questions and comments. Does that work for you, Ron?
Absolutely, brother. Thank you so much.
All right, great. So we'll take, without any further ado, I want to thank all y'all for being here. You got 67 really interested people here today on a Saturday. And I know that's going to fastly go to 680 and then 6,800. So let's take it away.
Hey, thank you so much, Steve. It's such a pleasure, and it's always such a pleasure to talk with you and the group that you bring on. I'm very excited. Thank you guys so much, and thank you so much for your time. And yeah, absolutely. Again, it's not something that I ever thought I would be in when it came to the healthcare space, understanding the healthcare world. For me, it was always my background is raising capital, starting businesses. I started my first one years ago. I ran correctional facilities. Yeah, I know I look like it. Look like I'm the guy that should have been in correctional facilities, but ran them for many, many years, and I've done multiple businesses. Really got into this space, the healthshare world, just kind of on a whim by a dear friend who was in the healthshare world for many, many, many years. Kept asking me, brother, please help me raise money, help me grow this. I got into it many years ago and fell just head over heels. I'm not from the insurance world, but when you hear me talk, it's going to sound like I know a whole lot about it. Why? Because I've spent years around insurance agents, because I was the guy that brought insurance agents into the healthshare space many years ago, not because it was some ingenious idea. It literally was just some guy walked into our rinky-dink office with the wrong piece of mail, and I tell everybody the rest is history. So what I'm going to talk about is HealthShare, and that's what I'm so passionate about, what it is, what it stands for, and how it is they can benefit you and benefit people that you guys know. And so HealthShare is not a new concept. It's been around a very, very long time, long before the ACA. Some people call it Obamacare. I don't offend people. I call it the ACA. It's been around a very, very long time. Matter of fact, insurance started this very way many, many years ago. So it's not a new concept. But when the ACA or the government got involved with healthcare back in the 2010 area, it was those of us in the healthcare space said, hey, whoa, wait a second. You're not going to penalize our members, that penalty tied to the ACA. You're not going to penalize us because we've been sharing as a community with a group of people that believe in what it is that we do. And it truly is taking care of one another. And so there was a set of federal statutes that came out, and that opened up the door to exempt for those health shares that met that requirement, exempt them from that penalty. And so that's where I come from. That is the idea behind it. But the great thing about it is what it did is it was able to teach me first and foremost, because if you can teach me, we can teach anybody. But it teaches people how to understand what their healthcare cost is. It's not some scam. It's not a gimmick. It's not a smoke and mirrors, what I tell everybody. It is a way to teach people that believe in helping one another on how to understand what that healthcare cost is. That's the whole idea behind healthcare sharing ministries. And so that's what it is that we do. So it opened up the door to caring and sharing. It's been around a long time. It's one of the oldest health shares that are out there. We've got members that are still sharing from the mid 90s. That is part of meeting the federal statute, is sharing prior to December 31st, 1999 without a cease in your membership. You have to also be a 501c3. You have to have a set of religious or ethical beliefs that everybody shares in. And yes, I'm a very, very, very strong man of belief. I don't cram my religion down anybody's throat. I love to tell everybody, hey, I'm a member of one of the largest non-denominational churches here in Austin, Texas. And I knew who my creator was. He hung out with everybody. So I'm open to everybody. It's not one set of religious beliefs. And so because of that, if somebody says, hey, you know what, that sounds like a great idea, then let's come together and put things in place where if somebody has a medical need, let's take care of it. Now, there are other health shares that are out there. You've heard of them. Some of the big boys that are in the space, and they're really, really good programs. Many of them are reimbursement programs. Well, we don't do that at Caring and Sharing. We don't want to be a reimbursement program. What is that? That is somebody, you have a medical need, you go, you negotiate it, you pay the self-pay discount, and you're having to negotiate with that provider. We don't want to do that. Why do we not want to do that? One, you're having a medical need. You're already stressed because of that medical need. Let's figure out a way to do that where we are working with that provider and negotiating that bill down on your behalf. That's what we do. And when I keep saying we, it's because I'm a member. I've been a member of HealthShare for a very, very long time. I love what it stands for. It teaches me to understand what my healthcare costs are. And Steve and I talk about it all the time. It's the one thing that we pay for in this country. We have no idea what the cost is. The reason we don't know what the cost is because we rely on the insurance world. We rely on the insurance carriers. You're going to hear me talk a lot about that. And I promise you, I'm not bashing insurance carriers. There's a need for insurance. But when we talk about HealthShare, it's a community of people that want to take care of one another that go, hey, let's start understanding what it is, what our healthcare costs are. Let's stop blaming everybody else and let's start paying attention. And that's what it stands for. Now, we're able to do that at a fraction of the cost of traditional insurance. And when I talk about numbers, it's 50% or better of a non-subsidy product. And we've all heard, what is subsidy? Well, that's meeting a certain threshold that you have to have from an income perspective to get assistance from the government. Well, there's 36 million people that meet that threshold of poverty or below. And those are people that I know, again, that need to have help. Why do 97 million people get subsidies in this country? That starts to concern me just a little bit. So let's start talking about putting a program out there that's been around long before, again, the ACA, probably a lot longer than a lot of insurance carriers have been out there. And that's the HealthShare space that does that as a nonprofit, working with the providers and on behalf of our consumers to make sure that they get the best medical care at the lowest cost possible. And so that's how we're able to do that. That's how we're able to put those price points out there that have a very robust product that everything from your prescription to your virtual telemedicine, behavioral, urgent care, office visits, emergency care, hospitalization, maternity. We're able to do that at such a fraction of the cost. How are we able to do that? When you start to talk to most people, they go, God, it's got to be some kind of, it's some kind of scam. There's no way. It can't be real. It can't be real. Well, it is. I love to tell everybody what was the cost of insurance prior to the ACA and when the government got involved. And what if you were part of an organization that was a nonprofit that didn't have a bunch of investors, that private, public companies out there that they have to pay people. They got to keep them happy. Well, I don't have to do that on my side of it. Why? Because I'm a 501c3. So I'm going to do that work for that member and for all of us as members on behalf of that membership while not cutting that provider's knees out from underneath them. But what if I could introduce a program that had a network where your member could use it wherever they're at? So if somebody enrolled right here in Austin, Texas, and they're in Fort Lauderdale having vacation, they have a medical need arises, and they just punch in a zip code into their phone, and they find a provider in their area, go have that medical need taken care of. And then that provider submits that bill into our system. We negotiate that bill down. We relieve that member of that medical stress get them taken care of. I'm not cutting that provider's knees out from underneath them. And you know why? Because I need that doctor. I need that hospital. But at the same token, the way that we look at things in caring and sharing is that doctor in that hospital, they're a business. We treat them like demigods. They're not. They're nothing but a business. They got employees. They got bills to pay. They got rent to pay. They got to keep the lights on. And every doctor friend I have's got 10 kids. And the average doctor, what, gets his medical student loans paid for when he's 64? They got bills to pay. The quicker we provide and pay that doctor or that hospital, the greater they're going to work with us. And that is the concept behind what it is that we do. And so that's what we want to be able to do, and do it at a fraction of a cost so that we are able to give that individual that medical need, get that medical need taken care of, ensure that price is at a very reasonable rate, and do so where it is not stressing their pocket, stressing the provider's pocket. Ultimately, all of a sudden now, healthcare makes sense and it's affordable. And I don't know the last time you ever heard healthcare and affordable. Boy, it's been a long time. So that is what it is that we do at Caring and Sharing. And again, it's a simple process. As I said before, that member goes, they show their membership card, they show their app. Every member has access to an app. They get that medical need taken care of. That provider submits that bill into the system. We are either going to pay the contract price, or based off of what that cost is, we're going to negotiate that bill down. And then we're going to share on behalf of that member directly to the provider for the member-to-member sharing escrow account. The cool thing is that member and provider, they get a statement that says, here's what the bill was, here's what was shared, here's what was discounted, and here's what the member's responsibility is. What if we could do that? Now, all of a sudden, as a consumer, we're starting to go, oh, now I know what the cost was. Now I know how expensive or how non-expensive that medical bill was. And that's the idea behind it. So we love, just like you guys do right here in Steve's team, it is educate, educate, educate. That's why we're so excited to be part of this organization, because what this team does is they educate. We want to be involved in that. We want people to understand what their healthcare costs are, because I'm telling you, there is not a single country in the world that has a bankruptcy tied to medical costs other than the United States. It is one of the biggest ways that people go into financial debt or bankruptcy is because of their medical costs. It's because we don't understand, as I said earlier, what the cost of our medical needs are. This is free enterprise. So is medical providers. It's free enterprise. You don't like the cost of it? Find somebody else with a lower cost. That's what it is. So if we're not insurance, then what are we? We're considered to be self-pay patients. So if we're self-pay patients, we dictate what that cost is going to be. That's what we do in HealthShare. That's what it's about. And at the same time, we do so in a manner in which we really give a darn about what's going on in our neighborhood, what's going on with our community. We want those people to be taken care of. And that's the idea behind it. And that's what I've done for so long. That's what I'm excited about. Maybe I'll stop for just a minute. Information overload. Steve, I'm going to let you figure out how we want to go from here, ask questions, whatever the case may be.
Sure. No, it's good. No, it's a very good overview. What I like to try to do is break everything down to the very simple levels. So, one of the secrets of success, everybody, as you're learning to master your marketing, master your millionaire mind, is keep everything at a fifth grade level. You never know what somebody's language is, right? So we always try to break it down. So let's go over this. Like, I am super excited about this, and that's the only reason we're going into this relationship. And I have brought very smart people. We have award-winning insurance people. We have people who've done a lot in this industry who have met Ron and behind the scenes before we've brought him to you. And we're all very impressed, very excited.
Thank you.
What we're looking at basically is, when I was paying Blue Cross before I moved to HealthShare a while ago, but I used to pay $1,600 a month. And then we had like $7,000 deductibles. We had family deductibles we had to meet, right? So it's like, oh, well, I got to spend $30,000 for this to even help me, right? So I think one of the basic things to do is just kind of give a couple of illustrations. What happens in our program as far as like not having a whole family deductible, but personal deductibles, and like what could happen with, say, the emergency room example that we went over.
Right, yeah. And that's the thing. If you want to get something that's affordable, and we're talking about non-subsidies. Now, we've all heard about it. We know what's going on out there. We hear it every single day when it comes to subsidies. I don't believe they're coming back. I just don't. I think that it should be there for those that are in need. It should not be there for those that are not, that do not need that. So when we start talking about what does it cost? What is it? So if I go to an emergency room, and that's what most people do when they don't have some type of coverage. Why? Because the rule is an emergency room can't turn you away. And what they're going to do is they're going to go, all right, we're going to just build this as much as we possibly can. We're going to try to build this consumer, and it's going to be something astronomical, hoping that at some point they pay for something. Or if you do have insurance, what are they going to do? Well, we all know that the provider is going to submit the highest bill possible to a carrier. Why? Because he knows what that carrier is coming back with. This is all we're going to pay you based off of Medicare. And now it's a battle of that provider just trying to get paid. And what was it, 3 years ago, 4 years ago, maybe a little bit longer than that, that medical bills can no longer be put on somebody's credit report. So now what are providers doing? We can't even do that. We're going to chase somebody all day long. So what if we put a program in place, which we have, that when that individual goes into an emergency room, their responsibility is $500. Now, at the time of that medical bill, usually the provider is going to try to get money at that. Well, you just go, hey, you know what? Here's my health share. So your responsibility is $500. The membership is going to share up to $5,000 per incident. Well, that's just not acceptable, right? An emergency room is going to be a lot higher than that. Well, yeah, it is if he's billing insurance. Again, I got to put as much out there as I possibly can to try to get any kind of money from this carrier. I'm going to negotiate that down. I got an amazing team of negotiators, and we're going to go, hey, Mr. Provider, that was a $10,000 medical bill. I'll pay you $3,500. Well, we'll cut you a check for $3,500 right now. You know how many times the provider's going to go, okay, yeah, that works. Why? They want to get paid. Why? They got bills they got to pay. So he's going to do that. So he says, okay, I'm good with that. $3,500, we submit that payment to that provider. The member's responsible for $500. The hospital is going to get a check from us, from the membership for $3,000. The member's responsible for that $500. That's how, and that's per incident. That's how it works. Now
let me interject. So, folks, some of you are familiar with our Pay Less for Bills program, where we're actually renegotiating the bills of companies on their behalf, right? So what Ron has done is so genius here. His model makes perfect financial sense so that the members who need the help are getting the help they need. The doctors and the hospitals are getting paid. They're getting paid now instead of fighting with insurance companies. And the model is so genius, it's been around since
1997.
97.
That's when we established 97. We were a little bit earlier than that, but our establishment is 97. Yeah.
And we're talking about it's still small enough for us to have an opportunity to share this. The price is low. I mean, it could be $500 or $1,000 less than insurance, but provides similar benefits. It's just the model's genius. And you don't come to a model like that without having years of experience in what doesn't work. right? So let's talk about mastering our millionaire mind as well. How did you learn the lessons that you needed to overcome and see the people's pain to create this program that could actually be a solution?
Yeah, that's such a great question. I mean, you start to look at what are those costs? Because again, if you put yourself not only in the position of the community member, the individual that's part of the membership, but also putting it in the hands of that provider. That's the thing that's vitally important, and that is you got to understand both sides of the equation. And when you're doing a reimbursement program, you as the individual that's having that medical need taken care of, you're like your only focus is on, well, I've had to pay. I'm the one in the medical crisis. I'm the one that's having to pay you. You don't put yourself in the position of that provider who goes, but I just gave you the medical care, and I got all these people in here, and I got to pay my bills. When you start to put yourself in both parties, now all of a sudden, that's why we want to eliminate the member as being, and I don't want to go and negotiate. I'm running the company. I don't want to negotiate with that provider. I want the team to do it. I want to be separated from the equation and allow us to be able to go, hey, we're on the outside looking in. Yes, we got to take care of this member. Provider, we understand you got bills. We got to be able to take care of you. So let's start to look at how can we come to the table and come up with a cost that makes sense, that allows us to be able to go, let's take care of you. We're taking care of this member, and then let's go. Oh, by the way, provider, thank you so much. We appreciate that. We're going to make sure people know about that, and we're going to make sure people are coming to you for business. Wait, you're going to promote me? Well, of course. Thank you. Hey, as the old saying goes, speed kills. It's not just in sports. It's also in paying bills. So if I'm going to pay that provider, 92% of our bills are office visits. Catastrophic claims are so minute, and that's what everybody puts their focus on. But what about a cancer claim? But what about this claim? But what about this astronaut? What about this? And that's where everybody's focus is at. That's not the majority of claims in the United States in the healthcare world. They're office visits. They're those small amounts. The average office or the average medical bill that causes people to go into medical debt is $3,500. Most people's credit card limit is twice that. That's usually that cost. But what winds up happening is people again get that mentality that, oh my gosh, my medical bill is going to be so high. It says $3,500. But it's because we don't understand it. So if we can be in the middle, come to the table and go, Mr. Provider, we're going to pay you this. We're going to take care of you immediately. Hey, a member, we've got you taken care of. And this everything's done. Bam. Here is a statement. Provider, you're getting the same statement, and we're done. It's that simple. It's not a novel concept. It's called business. Mm-hmm. We just eliminate that. So those are the things that we want to be able to do. Go ahead, Steve.
I like what you're doing here. Like we learned from the master Napoleon Hill, every business deal has to be good for both parties. And in this case, you're helping the member with lower prices, great program. You're helping the providers getting money in their pocket. They're willing to accept less now to get it now. And it's an affordable program. So what I like to do, everybody, if you'd like to see a little bit of the details, I could share the screen, and then we'll show you how you could actually get started. And this is going to be phenomenal because the people who get started with this are going to be trained. You're going to have your own replicated agent websites, the marketing, everything is done already. We're not creating it now. It's already done. So everybody will be able to get started today. And what's really amazing is, if you're going to become a licensed agent, you need to do 20 to 40 hours of education. You got to pay probably a few hundred to 1,000 or more, and it's a big thing. You got to renew. We have it's maybe a 20-minute, 30-minute course. There you go, and you will know what to do, and you can literally get started. And we're going to take questions after I show you this in a little bit. So hold your questions. But the beautiful thing about this is, folks, whether you can use this personally or not, you can refer others and you can make residual income like an agent, even if you're not an agent. And it's just a phenomenal program. So what I want to do is share my screen, and Ron and I can kind of go through this with you together. Let me hide floating meeting controls. There we go. All right. So this is healthsharerep.com. And I'm going to show you his company that's been around all these years is caringandsharing.org. So you'll be able to go there and go through everything on this website. Okay. You can't become an agent on this website, but this will tell you some of the details, right? So if we're going over here to healthsharerep.com, okay, what we're looking at here, and I'll just kind of go through this, and then Ron, you can kind of summarize whatever I miss. I love learning, and guys, the only way that you learn is by teaching. Anything you want to learn, you need to teach it. So this is healthcare that pays you back. All right, save up to 50% compared to unsubsidized ACA plans. Enjoy true provider freedom while earning incredible monthly commissions. That's what we're offering to you. Okay, we got 29 years, 50,000 members. We would like to come in here and double that number with you, Ron. That would be our goal. Okay,
Love it.
over 100, well over. He told me that's a very lowball number, but hundreds of millions in medical expenses shared. Okay, empowering your health. How it works: monthly contributions. They're put in escrow. The providers are negotiated. So we've made this very simple that you can understand. All right, you've got all these great things, and one of the wonderful things here is there's a 1 million plus doctor provider network. Okay, it's not a reimbursement, meaning that when you go there, you don't have to pay them and then you get paid back. Because if that was the case, there wouldn't be a negotiation done on your behalf. And the negotiation, if you take, Ron, just quickly, tell us about, a couple of the big ones, like the one cancer one that you mentioned, a couple of the big ones that you guys, how the kind of amazing negotiations that are actually able to be done, and how is that possible? Try to keep it short, but
yeah, absolutely. So yeah, thank you so much, Steve. So a lot of times what winds up happening is when you have a medical bill where there are pre-existing conditions, and ACA and all of that's out there, pre-existing conditions, you can't deny somebody coverage for a pre-existing condition. I love to tell everybody that's called guaranteed offering. So guaranteed offering does not mean guaranteed payment. So what's going to wind up happening is if it's non-eligible, and prior to the ACA, if you had a pre-existing condition, you got thrown into the pool. So what we do is we're not guaranteed issue. There are 4 medical questions. And all it does, if somebody has a pre-existing condition, we're going to tie a limitation to that pre-existing condition for hospitalization. So if somebody has a medical condition that is creating a limitation, it's not shared in. In the traditional, in most health shares or in the insurance world, if it's not eligible, they're not going to pay it. The consumer's stuck with that. I don't like that, and I don't believe that should be the case. What should be the case is, how do we negotiate that down? So, for instance, we had a medical bill, that a cancer claim that was not eligible because of our pre-existing condition, and it was a little over $600,000. Now, this isn't always the case, but at a great team, our negotiating team did a great job of tapping into the family financial. Why? Because every hospital district gets what? They get federal dollars. Use them or lose them. Everybody that you enroll into our organization, we're all part of a nonprofit. So our negotiation team taps into that. A lot of people love to go, well, you're double dipping because no, it's not. There's no such thing as double dipping. I'm a nonprofit. I'm going to use every resource available to us for our membership. What they did is they tapped into that. They wiped out that $600,000 cancer claim. Zero. Doesn't always happen, Sometimes we might reduce that down to a $30,000 bill reduced down to $4,000. The member's still responsible for that because the fact that it was non-eligible, but he's not on the hook for 4,000 or for 30,000. He's on the hook for that 4,000. Now, if it's eligible, we're still doing the same thing. We're negotiating that bill down. We're able to go, how can we tap into something to benefit the consumer, benefit that member, at the same time not putting the burden, excuse me, on the membership, and still working with that provider. They have to use those dollars. You just have to have experienced people that understand how to work on that. And that's
You guys know, you guys have the experience and you know how to do it.
Yes,
so
sir.
on a scale, everybody in the chat, on a scale from 1 to 100, how exciting is it to think that there's an affordable healthcare that you can make money with referring, and also they're negotiating the bills down? Let me see on a scale from 1 to 100 what you guys feel about this. And don't just, lip service. I mean, put it in there. Well, Carlos says 1,000. James has a lot of hundreds there. I am so excited about this. So let me get back, and I know we're going to keep it short, but we have all this great stuff here. So let's look about this. Let's say if you wanted to become an agent, okay? If you wanted to become a traditional insurance agent, expensive license requirement, long, boring 24-hour course, huge startup costs, long waiting times. Usually it's going to cost you up to $1,000, maybe a few hundred or over 1,000. Having to wait for open enrollment. So the insurance agents are really only able to sell in 1, 2, or 3 months. Then they're running around trying to sell little add-ons the rest of the year.
That's a great point. That's a great point, Steve.
And selling overpriced plans. I mean, one of our plans that might turn out to be $400. Otherwise, they might have been paying $800 or $1,200. So huge family deductibles. We don't have family deductibles. So here with us, with healthsharerep.com, the backbone of caring and sharing, you have a simple step-by-step training. It's going to take you, an hour, 30 minutes, open book test, very simple. Your own replicated websites that track all your sales, your ability to enroll an unlimited number of people, residual income month after month, like an agent without being an agent. Okay. And so this is a really cool site. You're going to have fun going through this. But personal referrals, the average family, the plans start lower, but the average family is going to spend around $550, $570 a month with this plan. And if you want to look at what that is, you're going to earn 7%. So that's about $40 per family that you refer. So if you referred 100 families, that'd be $4,000 a month residual income. This is not something that people stop paying for. This is something that once people are on the books, what's the retention like, Ron? Month to month?
Usually, yeah, you're usually anywhere between, the average is probably 22, 24 months. Sometimes you even see longer. I've had people on my membership for 17 years. People just get on it. And that's the great thing that you bring up. And that, Steve, and that is with traditional insurance, as he said with the ACA, you have to re-enroll every year. Mm-hmm. If you are on a health share, you do not re-enroll. You're on. As long as you're paying your monthly contribution, you stay on the membership. And so those, I've got agents that I'm paying commissions to and people that I'm paying commissions to, and that's not above and beyond. So I do not increase the cost of the membership. And guys, right now I'm paying 80-20. That's what insurance is supposed to be doing. And when I say 80-20, that's 80% of everything that comes in is going into the member-to-member sharing escrow account. 20% is your administrative cost. That's everything. That's commissions. That is your administrative. That's your third party. So we are 80-20. That's unheard of because insurance is supposed to be doing it per federal government, and I don't think they're doing it. But I'm telling you, right, so that is the key. So we're not asking to put anything on top of what that actual cost is. It's already rolled into it. It's already been through an actuary. We're one of the few health shares that use an actuary for our memberships, and it's already been run through there. So those are the things. And as Steve said, you can do this all year long. And the program that what Steve was talking about, the training and testing, Guys, I put the first training and testing together for healthshares for insurance agents many, many years ago. Built it. So any other healthshare that's out there using it, you know who you are. You stole my product and you stole my program. It's the same. It's the same training. We want people to understand how to offer, because what? If you see a great movie, you're just going to go do the same thing.
Yep.
Hey,
But this time we're going to get paid.
Absolutely. This time you're going to get.
All right, Ron, we're running out of time, so
go ahead, brother.
We're all excited, but let me get through this. So look, guys, here on this page, you can also have a little fun and play with this calculator. So, how many families you're going to refer, right? You're going to refer 10? Well, oh, you can use your arrow on this too, by the way, little arrows. $400 a month. I mean, this is a few $1,000s a year. Right there. And then you're also going to get a 10% match on anybody that you refer that also refers people. So we can do this, and you can play around with this, and you can say, well, I'm going to go after this and get serious. I'm going to bring 100 families to the table. So I'm going to be serious about this. And you could see, you bring 100, you can use your arrow, and maybe some of those refer a few. You could be looking at some really good income. Or maybe you just bring a few, but you bring on a couple of good agents. You might bring on like 3 or 4, 5, 6. But then some of them actually bring on a lot. And you're making money on their efforts too. So this is the best of both worlds. All right, so now, this program, I know healthshares and stuff, they charge hundreds of dollars to get started. If you're going to be an insurance agent, is going to cost you $1,000. I talked to Ron and he agreed this is going to be $97 a year. Okay. And so these are the plans. That's your agent cost. $97 for the whole year for the training, the website, the back office, everything getting held by your hand. These are plans for individuals as low as $289, right? We have 6 office visits, unlimited virtual primary and urgent care, hearing, durable medical, maternity and cancer sharing, laboratory services. And this is incredible programs, okay? Been around for a long time. There's some great FAQs on here. Any particular one of these FAQs you want to hit? What would you say your most important one is, Ron?
Most people always go, if it's not, is it legal? I love that down there because most people go, because we're not regulated and by the Department of Insurance because they can't stick their grubby hands in the cookie jar.
But you are very regulated with other entities.
Very, very. Everybody's making sure we're not selling an insurance product. So absolutely, you've got to meet that set of federal statutes. That's really kind of my favorite. The other stuff, great FAQs on there. Everybody did a good job putting this together.
And so what do you get for your $97 a year? We're not talking about hundreds or thousands. We're talking your own replicated website, agent back office, step-by-step training, ongoing support. Ron will be leading the team. Access to offer the healthcare program and earn monthly residual income. One thing I didn't put on here, Ron, is if I sign somebody up this month, when would my first commission be?
So if you sign somebody up and they go effective on the 1st, it's the end of the month. I don't make people wait 60 days or longer for that commission. I do it at the end of that month. So Perfect. Somebody goes effective the 1st, you see that at the end of the month.
All right. So then what training is involved? 10-minute training link. You watch that, covers the whole thing. Then you take a simple 20-question open book test. After that, once you pass, you get your portal set up and you can start referring people and earning instantly. So,
and one of the great things too is that you enroll yourself to be a part of it. I'm going to pay you that commission on your own.
You get paid on your own because you're the customer.
That's right.
Nice. So guys, this is it right here. And what we're going to do is we're going to take some questions. I know this is very exciting. These prices, people will look at it and say that can't be real, but it's real. And I am switching over. I'll be my own customer as well, starting on the 1st. So start your business today. You can refer others. This is it, folks. Only $97 for the year. That's it. Okay.
And I know I didn't even bring up the network. It's the First Health Aetna network. Guys, it's one of the largest networks in the country. What is there? 625,000 hospitals. I think First Health has 600,000.
First
You can
Health Network, if
First
anybody's
Health Network.
looking.
You can't go
Okay.
anywhere where there's not a First Health provider.
All right. So now, um, as Sandra said, 500. I'm personally so excited to see this opportunity to come to SHE because I've needed it for so long. Guy, I'm telling you, Ron, I have really felt bad the last few years because the demand has been there and I didn't have the solution.
I love
I've
it.
really felt bad. And now I feel like I want to cry, like I'm liberated. You know what I mean?
Well, thank you.
It's amazing. Um, so let's take some questions real quick. First of all, how many of you are excited about being an agent for this? Put a big me in the chat if you're excited about being an agent. Okay, Caesar's in, Bill, Anna, Leslie, Trevor, Marion, Donna. How many of you feel that for what you're going to receive in this opportunity, that this is a very exciting prospect for your life? That's something that you could earn residual income. I mean, look at all these people.
Very awesome.
Ryan
So
Swanson is on here. I want to tell you guys, he did a training in My Millionaire Mastery VIP, was amazing. How many of you were on the VIP training and you heard Ryan put a VIP? Was that amazing or what? Oh my gosh. Yep, look at that. Okay, so here's what we're going to do. We're going to answer some questions in a second, but I'm going to give you your call to action. That's your CTA. In marketing, you want to learn your CTA. We are only going to take, for this time period, 100 agents. Why? Why would that? Why do you think that would be? Because we want to give you personal attention, small group training, and develop you. So when we hit the 100 here, we're turning it off. And then when it comes back, it will probably not be at this price again. I just heard of another health share organization. They charge $300 to start, and it's a reimbursement program. This is not reimbursement. Guys, do you know how big that is? When I was looking at a health share before, they said, oh, it's a reimbursement. You pay it, and then we pay you back. I'm like, no, people can't do that. They can't pay $20,000 and then get paid back. But they can pay a few $100, and then Ron's team goes and negotiates everything and brings it way down. Is that making sense? James Cook says, count me in now today. So listen, you are at the right place at the right time because you are here. You know about this, and you may know some other people. I'm telling you, for this time period right now, to launch this, we are not going to take more than 100 agents. There are 84 of you on this call right now. When this recording goes out, it's probably going to be taken instantly. And it'll probably go out tomorrow or the next day. Well, tomorrow's Sunday, right? So probably Monday. So if you are interested in doing this, put a big me in the chat if you're going to go sign up right now. Put a big me in the chat. Let's see who's getting signed up right now. All right, so we got, oh man, too many. Anna, Bill, Debbie, James, Trevor, Emma. Okay, now that's wonderful, Jeremy. So all these people are signing up. But now I want to know why. I want you to put in the chat right now, why are you signing up? What is it that is interesting to you? Is it because you need it for yourself and your family? And I do need to say this. A lot of us are a little older. This plan only goes up to age 65. However, if you're 65, you can go to Medicaid or Medicare. But what you can do is you can refer other people who can get it. So even if you can't get it for yourself, you can earn monthly residual. Guys, ladies, if you're going to earn 30, 40 bucks per family you introduce, depending on their plan, 7%. And then you're going to earn a matching 10% on anybody they refer. You could go out there and refer a few agents, and there's how many agents in the country? Do you know, Ron? We have to ask.
Oh my gosh. When I brought agents within the first year, I had 10,000 insurance agents.
Yeah, 10,000.
It's astronomical.
Guys,
I don't even know the full number.
So here's what we're going to do. We're going to limit this to 100 of you right now for a certain period of time to get the whole community acclimated to this, right? Now, I'm not saying that we're going to limit it to 100 people to buy. We're going to take unlimited people to buy. You could refer 1,000 people. But we're going to limit it to 100 agents right now because I like to do this. It's like when we launch something, we keep it small and controlled. Like that's what happened with Ron when he first launched this. They had thousands of agents. They couldn't keep up. They had to pull the reins back, right? I don't want to have that same
Absolutely.
mistake. That's what we learned from our past, right? But Ron, talk to me like not as a salesperson, not as the healthcare guy, but talk to me like to our folks here. What do you really feel how will this benefit somebody? Like just take off the whole sales persona completely. Just look them in the eye and say, how is this really going to benefit the people who get it? And how is it going to benefit the people who sell it?
from from people who get it, and I've learned firsthand. This is personal experience. Again, this is not the sales aspect. I learned and I have understood what it's going to do, what that cost is, what that doctor is charging me, not what the insurance companies, my insurance carrier is going to pay. I understand what that cost is out of my own pocket. That's what it's taught me, and to understand that cost and to get everybody else out of the picture but me and the provider. That's what I've learned more than anything. That is more valuable than anything I've learned while I'm in this industry. And that's what I love so much about it, because I understand what that cost is. From a sales perspective or somebody that's referring that out to somebody, if you got the secret and you know you can save somebody thousands of dollars a year,
Mm-hmm.
tens of thousands of dollars a year, and they're on something that isn't near as robust as this, but they're going along with what is being thrown out there every single year. And all the media, we know open enrollment is coming. And you said it, Steve. I don't
Right.
adhere to open enrollment. You enroll somebody all year long. Well, you
Mm-hmm.
can't do that. We did before the ACA came around. You could enroll
Mm-hmm.
somebody all year long. That's what it is. So, from your perspective, if you could do that, and then I go, hey, you know what? You just referred somebody to a really cool movie, and I'm going to pay you for referring them. Even greater than that, what if you could save somebody's life? And as part of what it is that we do, we have a wellness program that's part of our life. That maybe that individual didn't know they had cancer. And I have people that you have to do based off of your age, you got to do a cancer test every year, and or excuse me, every 2 years is what I require. And I'm paying for them to have that cancer test, and you just saved their life, and you made some you made some money off of it.
Mm-hmm.
What a greater feeling than to be able to do that, because that's what we're supposed to do. I'm throwing anything, but Galatians 6:2 says the very same thing. We're supposed to take care of one another, and that's the whole job, and that's the idea behind it. That's what me and my team put in place. We truly do really, really, really care about it. So if you could do that and then make money on the side for taking care and helping people,
Yeah.
I don't find another profession that does that. I
Well,
don't
one thing
know.
I like,
That's the cool thing about it.
I've now had a few for those of you who are on the team here. I feel really good about Ron and the people who introduced him. I trust very, very well. One of them is a guy that we actually pray together, and I mean we met because of business. Actually, because he was working with Benefit Hub back in the day, and he brought that. When you call and it says "Thank you for calling Savings Highway Home and Auto," he got that done for us. Amazon didn't get that. We're the only ones who have that phone number, by the way. Amazon sends that company 10,000 leads a month. And we got the phone number, right? Because of him. He, the people you know and care about and trust, their word means a lot, right? But as I've gotten to know Ron, he has been extremely responsive. When I call or text, he's right on it. I told him about this call. He said, I'll be there. I'll be there. I'm here to help. And he is a Christian man. and the organization is a loving. It's called caring and sharing. I mean, he might look like a big bouncer in a biker bar, but I think he's a softie. But also I don't know
Hey,
if it's
every Sunday I protect my pastor every Sunday for
he's the
18
bouncer for the
years, and
pastor.
he is client, and I do it for free. I keep telling him I'm waiting for that check to come in, but he ain't giving me that check yet. But no, yeah, absolutely. Thank you, Steve,
And then his wife is a professional, how do you call it? Competitive,
she's
not
a
bodybuilder,
professional
but
figure competitor,
figure
bodybuilder.
competitor. So says she still looks like a woman.
She does.
But no, I really like these guys, and
Thank
he's
you.
out in Austin, Texas. Ton is out in Austin, Texas from the blockchain. I mean, two of our new business partners are in Austin, Texas. Is that interesting or what?
Mm, come see us.
So
Hey, it's
anyway,
actually
okay.
raining today. And I tell that's pretty rare because when it rained for 40 days and 40 nights, Austin got an inch and a half. So just letting
All
you
right.
know.
Well, let's congratulate the people who are in. So
Thank you.
I see Cindy is in, and Tom is in, and Mick is in. How many of you are in now? Trevor just joined, or you're joining right now. Put your name up here. We want to celebrate you. Who else is coming in? I like what Dustin said. Ron seems very transparent and knowledgeable. That's what
Thank you.
all of my team have met him too, guys. You know, I don't just go to in business with people unless they have that certain thing,
Thank
that
you.
trust factor. Okay, Thomas is going to join. Namaya joined. James is joining right now. Ryan Swanson just joined. You met him yesterday,
He
Ron.
was awesome. Yes, Ryan, good to talk to you, brother.
Oh, now you'll have to see the recording that he did today. It
Really
was I I was like,
nice.
I listen to great mentors all the time, and it was better. It was great.
That's sweet. That's awesome.
Kenneth just joined. Fantastic. Who else is in? Carlos is in. Congratulations. Who else is in? Now remember the merchant account that we're using for this is called Fan Basis because it's about coaching and personal development. So it's going to show up on your card as Fan Basis. Okay, it's 97 bucks. I'm sure when we roll it out again, it'll be 147 or 197. Okay, it's not going to be 97 again. But we're Debbie Denville, that's okay. You can do it on tomorrow. Leslie joined. Congratulations. All right, thank you so much. Let's give them a hand, Ron. Everybody, give them a hand for getting started. Okay, Ron, let's take some questions now.
Absolutely.
We did hit the whole hour, but can you spend how much more time? Can you do 15 minutes? Or
Yeah,
you
I am. Hey, look, I got rid of everybody out of the house, so
all right?
I am at
Perfect.
your disposal.
Okay, so we don't want you to just join. We want you to get your questions answered.
Please.
But if you feel this is right for you, join. If you don't.
Right.
Okay. But I think we're talking about $8 a month or something like that, right? For this. So I'm very excited to see all of you and congratulations. Let's take the questions now. Just type them in the chat. And while we're waiting on the questions, Omar, why don't you come on and, everybody knows Omar. He's our director of Latino relations. He's a business partner. I mean, we consult on everything, just like Tim Jones. Really, I'm going to tell you, if you guys want to know, the decisions are made between me, Omar, Tim Jones, and God. That's it. All right. So, Omar, could you unmute? Or are you good to unmute?
Yeah, yeah.
Tell us your honest opinion about this plan and the need and what we can do. Oh, by the way, we are definitely going to talk to this about small businesses because I want to answer that before you, Ron. But go ahead, Omar. What's
Absolutely.
your concepts?
Absolutely. No, I'm becoming a master on this. Ron, first of all, thank you for being on a Saturday with
Thank you.
all
Of course.
our family, SAG family, and all of that. This is a great opportunity. I built myself, like I raised myself in the health industry for 14 years. So I know
You know
that
it.
this is going to be huge for the entire SAG family and all the community because you said it, like I don't have too many questions. This is simple. You just, like you put it plain and simple for, like Steve said, for a 5-year-old to understand. And this is an alternative to insurance. But if I'm going to be helping people save hundreds, thousands of dollars every year, hey, sign me up every time because that's what SAG and all this community is up to, helping people save money. And we're going to have, like a great team. You have a lot of experience. You're not doing this, like you didn't start this yesterday. You've been around in the space for a lot of time, and that's exactly what we need over here. Partners like you. So I really congratulate everyone that is, like joined already and is going to be part of this, because 100 spots are going to go today. I'm telling you, when we start getting the phone and telling people, hey, sign up, because there's only 100 spot right now. And I tell you later where you're going to be, like getting and receiving and another income stream, another income opportunity, like, thank you. Like Steve said, like
Excellent. Okay,
God first, and then we take care of the rest, right?
amen,
That's it.
amen, amen. Let's get over to the. I'm sorry for cutting you guys off. I'm just trying to
I
push it
know.
along because respect everybody's time. But I just have to say, congratulations, Frederick. Jose Gomez. When I was a kid on my street, my best friend's name was Jose Gomez. My best friend was Mexican, then my best friend was black, and then I lived with a black dude. We were in a band together, and it was that place was like Jerry Springer in there, bro. It was crazy. And then I married a Colombian. So what's up with me? But he always said diversity is the key. Doris is in, Marion's in. Congratulations. Mick has this amazing question. Can we present this to small businesses and employee benefit where they pay for it with employees? So what I first want to tell you is, Ron's going to do the full answer, of course, but what I want to tell you is you can go into an employer and he can split it, he can pay for it, he can do whatever he wants, he can deduct it. We're going to list bill the employer, okay? So the things that I've learned, and you can correct me, so I like to teach because that's how you learn. If the employee quits, they can take the plan with them. Normally, with an insurance plan, if the employee quits, it's kind of like workers' comp in a way. It's like you got to keep paying them this thing called Cobra, right?
Cool.
That's terrifying for an employer. The employee quits, and the employer has to keep paying for that. And then there's all these other more details about it that are even more terrifying. With this, when the employee goes, the employee takes the plan with them if they want it. The employer doesn't have responsibility. So if you walk in, I'm talking to you, Dustin Smith, and I'm talking to you, Mick. You walk into a business and they have less than 50 employees, and you could sign up all the employees on this. And the employer's not making the commission, you are. So let's say you walked in and got a business with, let's say, 30 employees, and they all signed up for their families. That could be quite a huge, or even 10 employees. It could be an amount of money. That could be a car payment. 3 or 4 businesses could be a house payment. 10 businesses could be a house payment and trips to Hawaii. I mean, this is really good. And we are going to pay out more than the company receives, as we usually do. Okay? Not a whole lot more, but we're going to do it. We've been giving away the farm for 20 years. We got to make some money too to grow the company. But we're all going to win. We're all going to win in this. You're going to win. The customer's going to win. The employees are going to win. Savings Highway's going to win. Ron's Caring and Sharing is going to win. The doctors are going to win. The hospitals are going to win. And yes, there will be a dental share program as well, and a pet share program as well. So we're putting these things together too. There's going to be a lot of opportunity for you here, folks. So, Ron, what would you like? Is there anything I missed on that's important? You want
No, you nailed it. Hey, you know what? I'm just hiring you, Steve. That's it. That you're officially hired. No, you did a great job. No, absolutely. That's it. There's no such thing as a group health share. That's not part of the federal statute. But Steve is right. Anything under 50, you enroll everybody as an individual. We list bill that employer, and then what winds up happening is again that employer can do a payroll deduction if he wants to, but it's at such a lower cost. The great thing is that I got a whole team of people that are going to make you look like a superstar to that employer. We're going to send you a census document. You tell that employer, hey, fill out the census. We're going to send you the census, and you get to go, hey, Mr. Employer, here you go. But the cool thing is also is, guys, you are not alone in this. We're not just going, hey, here's the training, go get them. There is a team of people that I have that
Wow.
are designed specifically to help you guys in making you guys look like superstars, educate. I have been on phones, and I am the director of the organization, but I've been on phones with guys that are selling it with members. I try not to do it all the time because that just wear you down, but we're going to be here to help you guys out. So if you've got that employer, we're going to we'll send you all the information. We'll send it over to Steve and the team. They're going to send it to you and go, hey, do this, do this, do this, do this. And we will make sure. I spend a lot of time working with agents that I have, especially in South Texas. Why do I do South Texas? Because here's something we haven't talked about. You are not
Ooh. Oh,
required to have a social.
wait. Everybody listen. Listen to this. This
You're
is
not required
big.
to have a social security number to be enrolled into this. Why? Because I am not an insurance carrier, and therefore I cannot pull what they call an MIB. So I'm not allowed to do that. So I just go, well, and I'm just not going to require a social security number. Our organization owns the entire border of Texas and Mexico. So we do a lot of business on this side of the border in Texas because of that. And we work with a lot of employers. So,
So the insurance
yeah,
companies would require that, correct?
absolutely they do. Absolutely they do.
I mean, this is, praise God. That's all I can say. This is great. Other questions before we go?
Ron, we had someone asking
Yes,
about
Omar.
prescription. So you want to go over that really quick?
Yeah, absolutely. So the way that the RX works is that we have over 1,000 of your top generic. Usually, it's a little over 100 are your what you call your acute. Those prescriptions where they are you need them right now. Your doctor calls into the pharmacy. You're going to go. You're going to pick up those that prescription. It is not going to cost you anything at the time as long as it's on the formulary. The membership shares in 100%. The rest of those, a little over 800, those are your maintenance prescriptions. And what's going to wind up happening is that those are mail order, and we'll do up to a 90-day supply that gets sent to your wherever that location is for you to have that maintenance prescription. Anything that does not, and it's pretty rare not to find a name brand that has a generic. Generally, your diabetic prescriptions. Some of those are you can't find those, so those are discounted. But the rest of them, we want to make sure that our members are getting that prescription. And again, if it is an acute medication that you call up 2 o'clock in the morning, you got a sick child, you call into the telemedicine, you do a virtual. It doesn't have to be just telephonic. You can do a virtual. That provider can call in that prescription. It can be not. It has to be non-narcotic. They call it in. You have a 24-hour pharmacy. You go pick that prescription up. It doesn't cost you anything for the telemedicine virtual call, and then for the prescription, you're getting that child taken care of.
So what kind of prices is it for the mail order? Like how much about would that cost for the
So
different?
again, if as long as it's part of as long as it's generic, there is not. The only thing that members paying for is the shipping. If it is name brand, then those discounts are just going to be they're going to be based off of what that is. And there's a number on there that we help the member on ensuring what that discounted price
And the
is.
shipping is what, a few bucks?
Yeah, just a few bucks. Mm-hmm.
Awesome. Okay, congratulations, Donna. Congratulations. Carlos says, just finished joining Beam Me Up, Scotty. Emma she says, is this in Mississippi? All 50 states, Emma.
All 50 states.
All 50 states. And the beautiful thing about this, if you have correct me if I'm wrong, I understand if you have an insurance plan and you live in Alabama and then you go to Florida and you need to use it, you might not be able to use it, right? But with our
Correct.
plan, you could live in any state and use it in any other state. And he even has where you can get up to 50% if you're in another country, right?
So if you're traveling, correct. So the way the healthshares were started was basically for missionaries. So if you're traveling outside of it, you have to ensure that you're going to have to pay the discounted price outside of the country. As long as it's converted to US dollars and on the correct medical documentation, we will then submit, the member could submit for up to 50% reimbursement if they are traveling.
Awesome. Well, here's the website, folks, healthsharerep.com. If you have any questions that didn't get answered, email support@savingshighwayglobal.com. We have had a super Saturday. This is our third hour, going on 3.5 hours. So, yeah, incredible. I'm really excited, especially about what you were talking about later about the type of support. And like, we're going to make the people look like rock stars. You're going to train them. You have all the marketing materials, all this stuff, right?
Yes,
So
it's English, Spanish, Korean, all kinds of languages. Absolutely.
All the languages. So the beautiful thing about this, guys, we're dealing with a company that's almost 3 decades old here. We're almost 2 decades old. This works. This works. And I think one thing that they have been missing is you. Because I think we could bring this to 100,000 people.
Absolutely. Absolutely.
There's nothing to stop us with this program. It's completely legal. It's ethical.
Oh, yes.
It's a better price. It pays you like crazy. I mean, look, how many people are still on this call? And this is where you go, healthsharerep.com. And then you're going to have 2 replicated sites. You're going to have one that will get people to come into Savings Highway free first for it. Then they can buy it as a customer. That way we can lower their car insurance and do all the other things and help them save money. And then they can buy other stuff. Remember, folks, what you're getting with us is multiple businesses in one. You have your blockchain and your nodes. Lord willing, one day the healthshare will be on the blockchain. That's my...
Yeah, absolutely. I'd love to be on it. Love to be on it.
That's our goal.
Yes.
We want to create more utility than anything. I just want to congratulate everybody for being here. Awesome. Omar says, I told you, Steve.
We keep adding and adding. I told you, we're going to have everything in one place.
Yes. You do need to live in the USA to purchase this. Yes.
Mm-hmm.
Other questions before we go? Yes, the webinar earlier was recorded, but it's only for VIPs. It was very powerful private information. Any other questions? All right. Everybody, if you would like to, I think it would be wonderful. Omar, can we make it so they can turn their cameras on and their mics and they can come on and just thank Ron and give him a nice warm... Can this replace Medicare Advantage plan?
Let me see if we can do that.
Well, that's over. If you're over 65, it's just not in that space. And now I am working with it. I'm the guy that actually got healthshares out of 65 and older because it didn't make any sense. So I'm working with a program right now that is looking at putting a sharing back into the 65 and up. So I'm going to try to hopefully get that released in the next year. But it's everything 65 and below.
Is there a way that we can allow them to...
Steve, I think we are in the webinar. I don't think that we can do that here.
So what we can do is if you want to say hello and introduce yourself, especially if you got signed up, raise your hand and Omar, you can promote them to co-host, to panelist.
Yes.
Yeah.
I think so. Yes.
So if you got signed up, if you want to come on and say hello, I'm excited about this, guys. When I heard this thing, I was like, well, let me see what it is. And then I started to learn. I'm like, all the problems I had with the other ones are gone.
Thank you. Thank you. I'm honored. I'm truly honored. I really am.
All right. We're getting some people in as panelists now, right? So as you come on to panelists, go ahead and unmute and turn on your camera and you can say hello. Start of a beautiful relationship. All right. We're getting a couple of people in there. All right, let's start with, there he is. That's Carlos. There you go. Oh, and he went away. If you can unmute and say hello, Carlos, we'd love to hear from you. And I want to see, how do I say your name? Namai?
Naima.
Naima. Naima. Well, say hello, Naima.
Hey,
Hello.
this was great. This is
I got a
absolutely
but I don't
great.
have.
What do you like about it?
Well, as a healthcare professional, I know a lot of patients that are in need of healthcare.
Mm,
The cash patients that come in and have to pay $100 to $200 for a doctor's visit, and have kids, and for whatever reasons they can't get insurance. So this is a great opportunity for them to have access to insurance without breaking the bank.
thank you. Thank you.
Amen. I
It's a
think
pleasure.
that's our
Thank you so
commercial
much
right
for what
there.
it is that you do in that space as well. It's a space that doesn't get thanked a whole lot, but thank you for being in the space that you're in.
Thank you.
Thank you. And Carlos, you can
Uh,
talk?
mute. There, now you can. Oh,
There you go.
hi.
Yeah, introduce yourself.
Hi, Ron. I'm Carlos Navarez and my beautiful wife, Debbie. We are very excited about joining this program. She's in the medical field as it is, and she sees a lots of need for this type of program.
Yes.
Awesome. So
Especially
much.
given the Medicaid cuts and things that are going on
Oh,
within the
yes,
nation
Absolutely.
right now. So thank you
brutal.
so much for offering this to families and the
Absolutely.
opportunity. Thank you.
Absolutely. Thank you. And
Thank you.
you're
It's
a
nice to
vet,
see you,
Carlos, is that
Debbie.
right?
Thank you.
What was that again?
Are you a vet?
Yes, sir. I am Navy veteran.
Man. I am working with Patriot Mission, and they've invited me to be in DC for the 250th. But they've 250 small employer vet owned businesses, and dude, it's I'm so honored to be part of that and be you. I thank you so much for what it is that you do. I'm beyond honored to work with vets. That's for sure.
Thank you.
I was the first guy in my family who didn't go into the military. I went into correctional business instead. So, but no, thank you so much. I'm honored.
Thank you.
Thank you, Carlos and Debbie. And
Thank
Ryan
you.
Swanson.
Yes, it's a game. This is a game changer.
It is.
This is huge because with 1 million people just got laid off, AI's taking their jobs. They're not coming back. So most people want to have a job because of, healthcare. So now they're not going to have that. So they're going to have to be an entrepreneur. Obviously, you want to get them in your SHG business, then they can have, their health care stuff through this and have it be affordable. I mean, this is huge. You're going to be helping them save money and all their expenses and then save here. I mean, this is huge.
Thank you, Ryan, so much. I appreciate that. Yeah, you're absolutely, as a business owner, and I started my first business when I was 20 years old, and that's the biggest frustration is figuring out how do I cover that health coverage.
Yes.
So many people want to do things on their own, but I got to stay with that employer because they have my benefits. If you could come up with something that was so much more effective and cost effective as well, they could be their own boss and they could do their own thing. And that's what it is. So I'm coming at people from an employer from so many years ago. And again, the most frustrating thing, somebody brought it up earlier for small and business employer. It's the worst thing in the world, trying as an employer to go, God, do not come in here and try to sell me in benefits. I don't want to understand about insurance. So the great thing about what it is that we do is you can offer this up to that small employer and they don't have to re-enroll every year. Once they're on, they're on. So every year that employer does not have to go, how do I keep these employees with a quality benefit product? They're on. And as Steve was talking about from a COBRA perspective, if that employee that was laid off or fired or whatever the case may be, and they have to keep COBRA, that COBRA cost. So if that employee that was let go is utilizing that insurance, it affects the cost of that employer's premium the next year. So we could literally, I know personally, I had people in COBRA that did that. I had a 400% increase on my coverage on the following year. I couldn't afford health and benefits for my employees anymore. And we all know people aren't looking for what is my salary. They're looking for what is the benefit package. Now what we're doing is we're now helping that employer to be able to offer benefits up and compete in the space to keep quality employees and hire quality employees. Because the AI is taking away supposedly all the white collar jobs, but hey, all those blue collar folks, they need benefits. That's what this is all about.
And we're going to be very creative. Those of you who are interested in BEB 360 and Payless for your bills, you see how this all works synergistically? So you may have somebody that doesn't take the health share, but they'll just take a couple of the other benefits. You'll have a downsell, and you might start with some of the other benefits, and then they'll want the health share. So you'll have a downsell and you have an upsell. It's beautiful.
Absolutely.
And anybody else wants to say hello?
So
raise your hand.
From our perspective, we're going to push stuff to you guys. We want people to understand who our partners are. We want them to participate in what you guys are doing because that's what makes sense.
I love it. Good partnership. Anybody else wants to say hello? Don't be shy. Say hi. Just raise your hand. We're going to promote you to panelist. You got to hit the little hand raise button at the bottom middle. Anybody else want to say hello? All right. Okay. Kenneth says, thank you all. I'm a working man and also MMM VIP. Need to go to bed. I have joined. Congratulations. Anna, did you want to come on? All right. I think that's it for tonight. Thank you so much, everybody. God bless you.
Wait, Dustin is coming in. Dustin is coming in. Hold on, hold on.
Dustin's coming in? Okay.
Yeah.
You're going to like this young man.
Dustin.
Ron, mentor this guy. He is going to be a shark. He's going to crush it.
Love it.
Come on, Dustin. There he is.
Hey.
Hey, tell us what you like about this, bro.
Oh man. Just off the bat, I know several people. Well, I just wanted to say, hey, Ron, nice to meet you. You seem like a great guy. Thank you, Steve and Omar. No, I know several people that are always talking. They don't even have insurance. So this is great just to introduce them to that. And then just several places. My old job, every year, the owner, as a pressman at the printing company, they talk about how they have to switch to different insurance companies to try to cover everyone's insurance. All the employees are talking about how crappy the coverage is.
Well, this brings up a big important question here. Now, Ron, we talked about there was a 50. That business he's talking about has a lot more than 50 employees. So what are we going to do if somebody? How many do they have there?
Oh, well, just in that one building, they have 50, and she owns several different companies.
So what do we do if there's more than 50, Ron?
So what winds up happening a lot of times, if you're more than 50, I can't exempt that employer from the mandate for employees, meaning anybody over 50, they have to offer a qualified ACA product, meaning there is a 64 points that they have to require, that is required by the federal government, that an employer over 50 has to offer. Now, that employee can go, well, I'm not paying for that. Mr. Employer, you're only going to participate in $200. That's an $800 plan. So I'm 600 out of my. I'm going to decline that coverage because I can't afford it. Well, now all of a sudden that declined coverage opens up the door to be able to offer those types of employers or those employees that are over that 50 threshold. The other thing too, you can have a child only on this membership. So with most employers, they do not cover dependents. You can't afford it. It's too expensive. It's already tough enough as it is for a employee. So if they've got that employee coverage, we can go, hey, Mr. Employer, what if we offered something that was very inexpensive for dependents? Now what you're doing is you're sharing. The problem with group coverage is that a lot of people go, well, I sell group coverage. No, you don't. Most people don't sell group coverage because they don't know how to sell group coverage, because it's about service. Because if you were about it, then you could offer that. You could offer up options. So for those employees that want to decline that coverage, of the 50 and above, you then become that alternative to go, hey, you know what? Can we offer this then to those that want to do it? Now, once again, you just strengthened that employer's benefit package. You don't want to take this, but here's a more inexpensive option. Also, okay, I'm going to cover this. I'm going to give you your employee coverage. Do you have something for your dependent? Here's something that's inexpensive for the dependent. So you could put a child only on the membership. And I've got many child onlys on my membership.
Or just a spouse.
Or just the spouse, yeah.
Yeah. Sorry for interrupting you, Dustin. I was just concerned about that. I was hoping, like, I didn't want to make serious. Oh, you got your hopes up that you're going to go to those 300 employees that they have, but I just want to make sure how we're going to do it, right?
Yeah, there's some great options. Don't be discouraged by over 50. There's some amazing options that I'm a vendor for one of the largest, the largest broker in the world. I'm a vendor for them for their 1099 independent coverage.
Nice.
Okay,
Praise
yeah,
God.
and
Go ahead, Dustin.
I'll make it short. No, I just wanted to let you know I was excited about this, and
Thank you.
yeah, we have also a bunch of small businesses too. Once I get my mom's Rolodex going, Steve, we're gonna get to. I'm working on that.
Yep.
You know, she has a lot of non-compete stuff that I'm trying to work around and see what we can do. But as soon as I get her out of the printing industry, it's going to be game on. So, yeah, we have small
there's a way.
We can help you out with a comparison, apples to apples, because I have access to insurance products. So we can give you, Dustin, walk into this small employer, apples to apples, traditional insurance coverage from a group perspective, the healthshare, here it is right here. You tell me, Mr. Employer, which one. And oh, by the way, this healthshare, you don't have to go back and worry about next year. And what Steve and I've talked about before, and he didn't bring it up, I've had one contribution increase in 6 years. Insurance increases every single year. I've had one in 6 years.
Yeah.
Let's do it.
Yeah, as soon as I just signed up, so as soon as I start seeing the marketing material and stuff, I'm going to start right away. I really appreciate you guys.
Thank you so much. And Ron, we'll talk about when we want to have our first agent meeting.
Okay. Yes, sir.
And we'll let everybody know. But thank you so much, Ron. Let's give him a round of applause.
Thank you. No,
Thank you.
I give you guys. Thank you guys.
Thank you.
God bless everybody. And if you have people that you think would want to do this, get them in now, because I'm serious. We're cutting it at 100. Okay. So probably half gone already. All right. God bless you. See you later. Bye-bye.
Appreciate it. Thank you guys.